Hi there. I'm Dr. Michael Gambello, and I serve as the Section Chief of the Division of Medical Genetics at Emory University. Today, we're talking about carrier screening, an important topic for anyone thinking about starting or growing a family. It might sound technical, but don't worry. I'm here to break it down for you in simple terms. So what exactly is carrier screening? Simply put, it's a type of genetic test that can tell you if you carry genetic changes that could affect the health of your future children. Being a carrier means you have one non-working or non-functional gene that could cause a genetic condition, but you typically do not have any symptoms yourself. However, if both you and your partner are carriers for the same condition, your children might inherit both non-working or non-functional copies of the gene, resulting in a genetic disease. When is the best time to get carrier screening? Ideally, before pregnancy. This gives you time to understand your results and consider all your options without the time pressure of an ongoing pregnancy. That said, carrier screening can also be done during pregnancy. What kind of conditions does carrier screening look for? The test can screen for hundreds of conditions, including cystic fibrosis, spinal muscular atrophy, Tay-Sachs disease, and many others. Some of these conditions are more common in certain populations. For example, people with Ashkenazi Jewish ancestry have higher carrier rates for a number of conditions, including Tay-Sachs. Expanded carrier screening for many diseases is important to ensure that a couple's risks are addressed, regardless of their ethnic background. The testing process is straightforward. It usually involves a simple blood or saliva sample. After your sample is analyzed, you'll have an opportunity to meet with a genetic counselor who can explain your results and what they mean for your family planning journey. What happens if you both test positive as carriers for the same condition? First, remember that knowledge is power. Having this information gives you options, such as special fertility treatments that test embryos before pregnancy, using donor eggs or sperm from a non-carrier, prenatal diagnosis, preparing for the potential health needs of your child, and adoption. It's important to understand that carrier screening isn't about limiting your choices, it's about expanding them through knowledge and preparation. Remember, being a carrier is incredibly common. In fact, most of us carry several genetic variants without even knowing it. Carrier screening simply gives you information that can help you make informed decisions as you embark on your journey to parenthood. If you're thinking about starting a family and want to learn more about carrier screening, visit jscreen.org for more information. Knowledge is empowering, and understanding your genetic profile is one way to take control of your family's health story.